Hi, my name is Dr. Rachel Sample. I am a certified dyslexia interventionist with the Orton Gillingham Academy and the Center for Effective Reading Instruction. I would like to share some things about dyslexia because it is October, which is Dyslexia Awareness Month. Dyslexia affects 1 in 5 people, so it is, and it is extremely misunderstood. And a couple things that I want to say right off the bat is that these children that struggle with reading and writing are absolutely brilliant. I work with them all day, every day. They are absolutely brilliant. I have seen genius level IQs of children who cannot read. Now, it has nothing to do with intelligence. It has everything to do with this wonderful brain that we have in our head. It has to do with how our brains are structured. Now, I want to quickly give some background on reading. And reading is an invention. It is a human invention, it is a technology. I tell all my families this when I'm assessing and doing the initial assessment. Reading is a technology. So in order for reading to happen, every single human has to be taught, and we rely on different parts of our brain working together for reading to happen. So, a child that is born will eventually, if everything's functioning correctly, will eventually learn to walk. Nobody needs to teach them to walk. That is something that we were created to do. We were not created to read. However, humans in their brilliance came up with this system of decoding and breaking apart things to carry meaning. So for reading to happen, we need to use different parts of our brain. And a typical reader, so 80% roughly of the population, reading primarily happens on the left hemisphere of the brain. There are 3 parts working together on the left hemisphere that communicate in a nanosecond for the process for reading to happen. What they've seen on functional MRIs with students with dyslexia, this is before intervention, is that the process of reading is not only there's like one little spot on the left side of the brain lighting up a little bit, but when they get proper intervention, you're also going to get a section on the right side of the brain lighting up. So those that have dyslexia are not using totally the left side of their brain, they're using a little bit of left and right side of the brain when reading happens. So because we're making this journey across the top of the brain, across the brain, sometimes we can get lost along the way. Recall is difficult, and because they're not learning how a left brain student learns, they are learning a different way, so they have to be taught a different way. And that's where people like me come in, where we teach children with dyslexia or adults, people that have dyslexia. And that is what I wanted to say right away. They are brilliant. They just have to be taught how they learn best. Thank you.